Well, once considered a children's condition, cystic fibrosis is now affecting adults. To learn more about the disease and how advanced technology at Spectrum Health Medical Group is helping, please welcome Dr. Lehman. Good morning to you.
Good morning.
First of all, let's explain to people exactly what is cystic fibrosis. What happens to an individual?
Well, it's a genetic disorder, and it causes a defect in a protein which normally functions to thin down our mucus secretions in all organs. And when this protein is affected, individuals develop thick, sticky mucus in their lungs and essentially all of their organs. The lungs are the greatest problem because this thickened mucus leads to bacterial infections, which over time causes a decline in lung function and overall health. It also affects the pancreas. It makes it very difficult to maintain their weight and their nutritional status. So it really affects all aspects of these individuals' lives.
So what challenges exactly are they facing if they don't have someone like Spectrum Health there to help?
Well, at Spectrum Health and the Helen DeVos Children's Hospital, we offer a multidisciplinary team of experts. We as the physicians, we have nurses, social workers, nutritionists, and we work on all aspects of these individuals' care. So it's very important that they seek care in these larger centers. We're accredited by the Cystic Fibrosis Foundation in order to provide care for these individuals.
I'm sure there are different levels as far as severity when it comes to this. So how do you go about focusing on what's the proper treatment for each case?
That's a very interesting question. We really have to individualize the care, especially for adults who suffer from this disease. You know, they're working their jobs, they have families to care for. We have to find out what they can fit in on a day-to-day basis in order to maintain their health in the setting of their personal lives and personal demands.
Sure, and as they get into the adult life, which you guys have been able to do for many of these patients, they want to try to maintain a working lifestyle and that sort of thing. So are there treatments that they can bring along with them to help them get through their days too?
Yes, there are. We've developed many new ways to make therapy easier. We can do nebulized or breathing treatments on the way to work in the car. There are many medications that can now be delivered faster in order to minimize time spent during their busy day doing these therapies. All of these things are very important.
And since you started working in this specific area, how have you seen things change and maybe lifestyles actually go a little bit longer each day and a little bit farther in life?
It's been very exciting. You know, 5-10 years ago even, people were not living as long as they do now. At this point in time, over half of the people in this country with CF are 18 and over, which is very exciting. And the median life expectancy of people with CF is now up to 41 years of age, which is incredible.
That is incredible.
Yes.
So if someone's watching at home and maybe they have, you don't want to scare anybody by any means, but are there some symptoms that people should really watch out for?
The big thing is chronic lung condition symptoms, cough, a lot of sputum production. Sometimes we see adults diagnosed when they're older. They've had chronic sinus symptoms. They may have been told they have asthma, and often these can be warning signs of cystic fibrosis.
Okay, well, her staff is there to help and to go ahead and to get in touch with the Marykay at Spectrum Health Medical Group Pulmonary. Give them a, stop by at 4100 Lake Drive, Southeastern Grand Rapids, first of all, but give them a call too at 616-267-8244. Visit them online. So much information there at spectrumhealth.org/lungs-sleep. Thanks so much for stopping by.
Thank you for having me.
Absolutely.